Hi guys, so today we're talking about toxins, poisons, drugs. We're going to be focusing on the drug part of this today. So, drugs and crime. About 1 in 5 people who are currently in prison are there for some sort of drug offense. About $600 billion is spent annually in the US on drug addiction treatment and dealing with drug related crime. In 1994, 5.6% of all homicides were drug related. This is the highest number that has been recorded up to this point. So that was about 22,000 deaths. Kinds of illegal drugs. You've got three basic kinds. Hallucinogens affect perception of what you see. Narcotics are addictive. They are depressants. They induce sleep, and they slow your central nervous system. Then you've got stimulants, also addictive. They speed up the messages traveling between your brain and your body, and they make a person feel more awake and alert or more energetic. You have schedules of drugs. There are 5 schedules of drugs. A Schedule 1 is the worst kind. They are the most addictive and most prone to abuse. So things like heroin, LSD, peyote, MDMA, bath salts are all Schedule 1s. The least addictive drugs would be a Schedule 5. They're widely used for medicine. Cough syrup, Tylenol, codeine, these are considered Schedule 5 drugs, meaning they're less addictive and less dangerous to you. Alcohol is a drug. It is a central nervous system depressant. It slows down the connection between your brain and the rest of your body. Strength of alcohols are generally expressed as proof, which is twice the percentage that they are. So a liquor is 80 proof, that means it is 40% alcohol, and the rest of it is water. But 40% alcohol is a lot. Someone with a blood alcohol of 0.15 will retain that alcohol in their body for 10 hours. That's how long it takes for your body to get rid of it. It takes 30 to 90 minutes for alcohol to start being absorbed and fully absorbed into the body. Isopropyl alcohol is the kind that you buy at the drugstore and you would use to like clean a wound. People who drink that, it will cause nausea, vomiting, unconsciousness, possible blindness. So it's a big deal. Ethyl alcohol is colorless, and that's what makes up the alcohol in beverages. So you've got isopropyl and ethyl alcohols. Alcohol is the most abused drug in America. It is a drug, even though it is completely legal. 40% of all traffic deaths are alcohol related. The liver, your liver is where you sort out alcohol, which is a toxin. It gets removed from your body, but you can do permanent damage if it's constantly filtering out alcohol. The legal limit for driving under the influence in Washington is 0.08%. These are determined by breathalyzer tests that basically rely on something called Henry's Law. A chemical known as acetone in diabetics will act like an alcohol. So it gives a false positive on the breathalyzer test, and it will actually affect their behavior in the same way that alcohol will, even though they haven't been drinking. But if they're having a diabetic episode, they could look like they were drunk or behave that way because they had that acetone in their system. Another thing that we need to talk about a little bit are bioterrorism agents. Ricin is one of them. It is basically a waste product of the production of castor oil. A small dose, like the would fit on the head of a pin, is enough to kill a person. 1 milligram of ricin in food or water can kill an adult. Another bioterrorism agent is anthrax. Anthrax is a naturally occurring bacterium, and it releases this toxin, the bacteria does. And when you breathe in this, it can be a powder, or if it's airborne and you breathe it in, you're going to have a lot of flu-like symptoms and you will be very, very sick. And it's almost always fatal in that when you breathe it in, unless you get aggressive treatment, and then it's about 55% of patients who will survive inhaled anthrax well. In summary, controlled substances, you can have hallucinogens, narcotics, stimulants, steroids, and depressants. The lower the scheduled number of the drug, the more addictive and dangerous it is. And bioterrorism agents that we just talked about were ricin and anthrax.